everyone, welcome back to my channel. So for those new here, hi, my name is Jenny. I'm a family medicine physician and a mom of two. And so today I'm going to talk to you guys all about headaches, what I did to personally get rid of my headaches, and some of the alternative therapies that medicine doesn't really talk about. So if you guys are interested, then keep on watching. So recently I posted up this picture on my Instagram stories telling you guys that I got Botox specifically for my headaches. And you guys had a lot of questions. Disclaimer, please understand that Botox is probably the last line therapy for headaches, either tension or migraines. So I'm gonna go in a stepwise fashion from the most conservative, which is things that you can do at home, to other things that you can possibly ask your doctor about. But since you guys had so many questions, I'm gonna talk about the Botox first. So I have a condition which is called bruxism, which is significant teeth grinding. My back molars are really flat. I've even chipped a tooth in the past due to grinding. And the reason why I do it is just stress, and I grind my teeth at night. This causes significant tension headaches, radiating up to my temples. I wake up in the morning with headaches, and sometimes pressure here can help. Sometimes it's so bad that you can develop migraine headaches where you have changes in your vision or nausea, sensitivity to light, basically puts you out for the rest of the day. And so I got Botox into my masseter muscles, and I got 25 units on each side. What botulinum toxin, or Botox, does is injected directly into the muscle, and this causes the muscle to atrophy because it paralyzes the muscle. So it doesn't allow you to clench as much. So my Botox, usually they recommend every 3 months, 3 to 6 months. The caveat to this is that it is so expensive. So just to give you some numbers here, Botox per unit can range anywhere from like $8 to $10 to $15. And I said I got 25 units on each side. So if you do the math, hold on, I'm like an Asian that's super bad at math. So 25 plus 25 is 50. Let's use 10 because it's an even number. $500. So that's $500 for injections of Botox into your masseters. But it completely resolved my headaches. And as I said, it paralyzes the muscle, but over time, the Botox wears out and you regain strength. And so the more you work out a muscle, the stronger it gets. So with every time you talk or when you chew food, things like that, you're still using these muscles right here. So over time, they will come back and you might still have the same problem and need Botox again. So is this covered by insurance? Yes and no. So usually it's cosmetic. Because a lot of people do this for slimming of the face. A lot of Asian cultures do it. Maybe Kylie Jenner did it, I'm not sure. But you inject it into the muscles here, and then it does a lot of slimming in your face. Here, I'll post the picture again, and you can definitely see the before and after in my pictures. And I think this is about 4 to 5 months difference, maybe even 6. But you can definitely see a difference, or at least I do. Ways that you can get it covered by insurance. If you have tension headaches, you have to be seen by a head and neck specialist. So the head and neck specialist have to determine that your issue is based on these tight muscles, and after that, then maybe partially the Botox could be covered. I have seen them work super well for migraine headaches, which is different than tension headaches, but it is one of the best treatments for migraine headaches. Unfortunately, insurance companies make you jump through hoops to get it. You have to have tried over-the-counter things like ibuprofen. You've had to try like 5 different types of medication in different classes, such as anti-seizure medications, blood pressure medication like propranolol or verapamil, or like an antidepressant such as Effexor, or like a muscle relaxant like Flexeril. You have to try like multiple medications from different classes before they even allow you to be covered for Botox. So if you want to get that process started, definitely ask your neurologist. Not all neurologists would do Botox, but I know the particular neurologist that works with my clinic does. Oh, and another way you can get around this is if you find a program who they are training people to do Botox, and you can get it done for free if you volunteer. So my residency program trained us all in Botox and fillers, and we needed to get volunteers. So I specifically volunteered for this, and Paige, she is awesome. She saw that I told her I had headaches and I had like really bad jaw pain here, and she recommended that I get my masseters injected, and seriously changed my life. But you can find these people, like dermatology residents do this, some family medicine residents will do this, and maybe reach out to the companies to see if they have like big training seminars, and you can volunteer. And it happens pretty frequently. So my residency program, every 3 months they will have volunteers come in for injections, either Botox or fillers. So that's something that you should definitely look into if you are interested, and it's free. Now that we got that out of the way, I want to talk to you guys about some of the things that you can do to treat your headaches at home. And a lot of the times tension headaches are due to, all the time, tension, right? So tension in your muscles, in your shoulders, that is radiating up to your head. Your head has muscles like the temporalis muscle, the pterygoids, the masseters, the trapezius, the levator scapulae, all these muscles in your head and neck, or even in your back, all the way down, like your whole body is connected. And so tension in other places can contribute to migraines. So, easiest thing, you don't have to have anything with you, just need a hand, preferably with a pinky finger. Okay, and I'm going to teach you a little bit of manipulation that I would personally do in the clinic. And so, as I said, you can have really tight muscles here. The pterygoids come here, connecting from the pterygoid palate down into your lower jaw. And so use a clean hand. And I'm going to use a glove so you can easily see what I'm doing. So you're going to want to take a clean hand and take your pinky finger and run it along the top side of your teeth and your gum line all the way to the back. You're going to feel some resistance between like your teeth and this muscle back here. It's going to feel really tight at first, but with gentle pressure back here, it will eventually loosen, and then you'll be able to push all the way back into the soft palate back here. So it kind of looks like this, right? And it's gonna hurt, so don't go too hard on yourself. Okay, so you're gonna go back here, and then I feel it like right here. The muscle is super tight. And so and that's all you do. You leave the finger there with gentle pressure until the muscle releases. For my osteopathic medical students, if possible, try to balance the temporal bone. You can stick your finger in the ear, hold it on this side or hold it like this, and try to release it at the same time while balancing the temporal bone. So you can try that and see if it helps. This will also help with TMJ. So if you suffer from that, you can definitely try to release those muscles. And then you would do the other hand for the other side. It's kind of hard to put your hand this way. So I would use a pinky finger and put it along this side and this side. Okay? I feel like I should do this side now because this side's loose and this side's not. I have really bad TMJ too, so like my jaw is like shifted to a side. All right, second, golf balls, or not golf balls, tennis balls. So there's lots of different types of tennis balls. These are the classic tennis balls. There's also this other one that is a little bit softer. So you will just have to see which one is best for you, the most comfortable. So I find that my patients with fibromyalgia, a lot of too hard of a pressure can be too much for them. So I recommend like a softer ball, but tennis balls are the perfect size. What you do is you grab a tube sock, preferably a clean tube sock, and you put your tennis balls in there and you push it all the way down. Okay. And then you can tie it off. Okay, just like that. And then now with this, you have the perfect shape to release your suboccipital muscles. And those muscles are back here. I will show you pictures on my atlas. But what you do, let's tie this hair up real quick. So what you're gonna wanna do is you're gonna take your newly made suboccipital tool, and then you're gonna place it right here in the back of your skull, and you're gonna wanna lay down on it, right? This itself puts pressure points onto your suboccipital muscles, causes them to release and relax. It also gives a little bit of inhibition to the suboccipital nerves, which can be causing you some pain as well. So yeah, try that out. Oh. I also like to tell my patients for this that they can use it on their back as well, like in between their shoulder blades. If they don't have a foam roller, you can also use it against the wall if you have a hard time laying flat, and that really helps loosen up those muscles as well. Next, anyone with TMJ or like severe bruxism or teeth clenching, I always recommend a night guard or a mouth guard. I got mine off like Walmart. I think they have some at Target too, because it was cheap. It was like $30. My dentist actually recommended that I get like specific night guards or something like that, but she quoted me like $200, and I was like, I'm a very poor resident with 2 children with lots of loans. Like I really can't afford it right now. And so the best thing after that was just an over-the-counter night guard. And so definitely try that if you suffer from like severe teeth clenching or grinding at night. It should help you with like from waking up with those headaches. So I taught you guys a lot of different OMT techniques that you can do at home by yourself. If you guys don't know already, I'm an osteopathic physician. I do a lot of OMT in my practice. A lot of patients come to me specifically for OMT to treat like their back pain, their headaches, their fibromyalgia, and lots of other things. If you have a hard time finding a physician who practice specifically OMT, I'll link a website. I think it's like cranialacademy.org or something like that in the description box down below, where you can just type in your zip code and it'll pull up all the different providers who practice osteopathic manipulative medicine. And that being said, other things besides OMT that I can do for you in my clinic is, you know, if these tennis balls worked for you and it only gave you a little bit of relief and then they came back shortly after, we can do what we call a suboccipital nerve block and put a little bit of like Kenalog or steroid in there, and it helps just like calm down the nerve. It's an anti-inflammatory. We put a little bit of lidocaine, and the hopes is that it will give you months of pain relief, hopefully 3 months, if not 6 months of pain relief, and we can do that directly in the clinic. I also do things like trigger point injections or dry needling to help with tight muscles in the shoulders. So what happens is that when a muscle is really tight, you put something in there, and what it wants to do, your muscle, is push that thing out of your body. And the way that it does that is by relaxing. How do I say this? Pathophysiology behind that, or so basically that's the mechanism behind that.
Another procedure that I perform in the clinic for headaches is called the Sphenopalatine ganglion block. And what I do is I use the specific catheter to spray the sphenopalatine ganglion. And what this does is that the lidocaine helps reset your autonomic system, specifically the parasympathetic system, to prevent headaches. It's also known to be associated with trigeminal neuralgia, and this has helped a lot with those particular cases.
And then lastly is the Botox, which we had already covered. So I'd be a horrible, horrible family medicine physician if I didn't talk about what causes you to have these headaches in the first place. And if you're having a lot of tension, we also need to address how you're dealing with stress. You know, like I found that I had the worst headaches or worsening headaches when I was about to take exams, or when I was stressed in my residency or in my home, or when my kids were just going crazy, like when life was like extra, right? And I think everybody's triggers are different. Sometimes with migraine headaches, they're hormonal. It comes with your period, that time of the month due to hormone changes. Sometimes it's like a certain scent or certain foods that people eat. I highly recommend people keeping a migraine or headache diary. So in your headache diary, I highly recommend people to write down when their headaches occur, how long it lasted, was there anything that made it worse or made it better, the things that they tried, and any triggering factors, because unless we know what is causing these headaches, it's harder for us to truly get rid of them forever, right? And so using that information, I think like trigger avoidance is a really good thing. Learning ways to deal with stress is a really good thing. Like for me personally, I need to learn to meditate. I need to do more yoga. I just need to smile and laugh more, and just do things that make me happy. So yeah, that being said, I am doing a Vlogmas this year. So all of the month of December, I'm doing 12 days of Vlogmas, hopefully. And I'm talking all about mental health. So like depression, anxiety, ways to make you feel better, and just living an overall healthier, happier life. So don't forget to subscribe so you don't miss any of those videos. They'll be super random posting times. I hope you guys learned something today. Remember that I, as a doctor, am speaking in general terms. I am not legally allowed to give anyone medical information through the internet. Not only is it not legal, it is sometimes dangerous. So please don't ask me any personal questions, but I can answer questions in general terms. So yeah, thank you guys all for watching, and I hope to see you again soon. Peace.